3.
Hello everybody, and in this little short film I'm going to show you how to do Indian foot massage, which is part of the AYURVEDIC, the general massage, Indian massage, using Ayurvedic oils as well. And what I'm going to do now is I'm going to show you how to position the client. The client is going to be supine, the leg is going to be flexed, and you can see the knee is 90 degrees over here. I'm going to sit on the foot right over here. So what I'm going to do is I'm going to take a towel, place the towel over there, that's for padding, alright. You're going to sit on the foot gently to do some compression, and then you're going to start with no oil massage. In other words, you're going to do some compressions. And what I'm going to do now is I'm going to pass my forearm fully through underneath the knee and press towards me in a compression stroke. This is also great for the lymphatic system. Alright, in this next section I'm going to show you how to do the posterior leg and the sole of the foot. Before I go on, I'd just like to point out, for example, under the lateral malleolus over here, we have a point for the breakdown of fatty tissue and reproduction, okay? And then on the actual foot itself, we're going to have points here for the brain, digestion and that, and the actual foot mechanics, which means, in other words, any kind of foot pain will be addressed by 1, 2, and the third point over here. It also brings down the prana from the head, grounds the person, makes them more mentally calm. Alright? Then over here we have another point, another marma point. Okay, marma points are acupressure points. Locally it will affect the gastrocnemius, the plantar flexors, but it's also good for the digestive system as well. Alright, here you'll notice that my client is supine. The first stage now is going to show you some of the most important points that you need to address. It's going to involve chakras and marmas. First of all, we're going to identify the main chakra points and marma points. On top of the head, where the bregma is the marma point and near the 7th chakra. Okay, this one relates to the kapha part of the body, brain, nervous tissue, right? That will be activated by going directly on top of the apex of the head. Here, of course, is the third eye, great for sinuses, great for sedation, opening up intuition and that. Then we're going to go to the heart. The heart, find the xiphoid process, okay, where my middle finger is. Okay, that's where the heart is. This one here is for Pitta constitution as well, blood and circulation and the heart. Then we have the Vata. The Vata is about 2 or 3 finger widths below the navel, about over here. And also the dimension of the points. Usually you safely can assume that we're talking about the width of 2 fingers, okay, more or less, depending on the proportion of the client. This one over here has to do with the bladder and the urogenitary area and the colon. So this is elimination, this is Vata. This is Pitta again. Pitta, heart and circulation. And on top of the head, on the bregma as it's called, near the apex on the head on top, that is your kapha. Okay, 1, 2, and 3. So before we do the actual massage, we want to calm the patient down. Maybe the patient has issues with the digestive system, heart. So first of all, we're going to place the flat of the hand right below the navel, and then I can combine it by placing my thumb gently on the third eye. You let it rest there a little bit, and then from where you're standing, you're going to rotate counterclockwise. Right, this next section I'm going to show you a little bit about the back, the points that are important. and basically how to massage the back. Again, refer to your manual for this. First of all, we're going to address this point about C1, C2. There's a little hollow under the occiput. Okay, in Chinese medicine there's also a point there. This is great for neck stiffness and stimulates the mind. One of the functions of Abhyanga or full body massage is to stimulate the senses as well and clear the chakras. Alright? Then over here on either side of C7, alright, 2 finger widths across. This area is for the throat chakra. Okay, also has marma points. Marma points right on the shoulder here. Marma points on the edge, on the medial edge of the scapula, metascapula, inferior point. Right over here is the superior angle, inferior angle, superior angle. Root of the chakra. Next to the root of the chakra is an important point for respiration as well, and locally for muscular any kind of myofascial pains syndromes. And then all along the vertebral border you should also palpate for any sore tender areas. Midway where the waistline is, more or less, also 2 points for the liver and spleen, which are great. Then against the iliac crest on either side is the spine, L4, L5. There are points then for the lumbosacral joint over here as well, urinary bladder, adrenal area as well, so right on the sacrum, and also of course for the second chakra. Alright? So what you should do is first balance the chakras and marma points. So what you can do here is hold the patient in this position. My thumb is on that point for the mental calming, and then sedation, you're going to go counterclockwise.